So we want to go into a panel discussion, and this is where we're going to have an interesting conversation that is going to relate also into the healthcare system. We want to know much more about that, the era of exponential improvement in the healthcare system, technology-driven innovation that holds the potential to improve our understanding of patients and also enable the delivery of more convenient and industrialized care as we create more income, especially by 2025. And that's a conversation that we want to get into. And the one who is going to carry us through this particular session, he is the CIO at Gertrude's Hospital. This man is seasoned to the bone and marrow. He is an award winner here also at the CIO 100 Awards. This is a man who has perfected that particular industry and is going to come and tell us how innovation can be able to come and help the healthcare system. So we are glad to have him here. He's the CIO at Gertrude's Hospital. This is none other than Peter Kanda. Thank you so much, Peter. We're glad to have you here, and we're looking forward to an engaging session as we carry this conversation forward. Thank you, Peter, and over to you. This is CIO Africa Year Ahead Forum. Welcome, and my name is Ian Mwerore. I'm your moderator, and I'm glad to be here. Thank you so much. Over to you, Peter. Wait.
Thank you, Ian. Ian is very kind with his words, but we all know Ian. Yeah, so we are entering into our next topic, which is the era of exponential improvement in healthcare. And my name is Peter Kanda, CIO of Gertrude's Children's Hospital. I'm glad to lead these discussions, and I'll be joined by my panelists today. And we are going to focus more on the era of exponential improvement in healthcare. And technology-driven innovation holds the potential to improve our understanding of patients, enable the delivery of more efficient and convenient individualized care, and create 350 billion to 410 billion in annual value by the year 2025. So quickly, I'll go in and get my panelists to introduce themselves. So we are joined in by Nikki. So Nikki, you can introduce yourself, tell us what you do and the company that you are in. Nikki?
Thank you, Kanda. My name is Nikki Nyamasio. I head technology at Maidawa. I have around 14 years of experience in the industry across different verticals, but more so, the better part of my professional past has been around supply chain automation across, again, different verticals. So here at Maidawa, I provide leadership on our technology and building what we call a robust, secure and innovative product, platform for all our stakeholders, with a view to remaining the leading e-pharmaceutical chain in the region.
Okay, thank you, Nikki. We're going to jump in quickly to Samuel. Same, you can introduce yourself, tell us a bit more about what you do in the company.
Yes, good morning, everyone. My name is Samuel Weru. I work for Amref Health Africa. It's a common name and household name most of the people growing up in Kenya and the East Africa region. Currently, I am the Group ICT Director for Amref, and we span across, we have our interventions across 30 countries in Africa region. And we also have operations in Europe and also in North America, that is USA and Canada. So my work is to lead in terms of strategic decisions that involve investments in technology, innovation, and still on the operational aspects of the whole organization. And great interest in the communities that we work for and interventions that will have impact on the community and changing their lives for the better and bringing a lasting health change in Africa, especially. Yeah, in a nutshell, that's who I am. Thank you.
Thank you. We'll later on be joined by the CEO of MPSHA, Tosif Dean. But for now, we'll get on to proceed. Now, you've heard the topic, the era of exponential improvement in healthcare. And I know MyDAO has really been in the space, AMREF has really been in the space and deploying technologies to address their users' needs. How do you think the healthcare providers, the solution providers like MyDAO are ready to tackle this? Nikki?
Thank you for this question, and I think it touches on the very large topic of what do we see in the future of healthcare, and I think it would be fair to make this observation that regardless of the segment that we play in the industry, you could be a support service, you could be an actual hospital, for example, or a chain of hospitals, you could be a pharmaceutical distributor or even a retailer. But what we've seen in the last few years, and if we could look at what we expect to come, is there's a lot of awareness, in our common consumers of our services, So today we have a more aware, a more informed patient, than before. And with this, and with the introduction of things like the Data Protection Act here in Kenya, Data Protection Act of 2019. Now, we are compounded with an environment where, looking forward, then we've got to step up and be at the very tip of innovation and use of technology to keep up with the needs of our current consumer of our services.
Yeah, and back to you, Samuel. I know same question really. AMREF has been there for some time. MyDAO, I know they're now getting into the space properly. But for AMREF, how are you guys tackling this era that we are in, where technology is really becoming a key differentiator for healthcare providers?
Okay, thank you for that. I think I would address it from a perspective of, let me just say, AMREF being an NGO, but an NGO with a difference in the sense that we engage the stakeholders and we engage at wider levels across the globe. And we have different levels of healthcare interventions all over the world from one country to another. But what we have done especially is to concentrate much on community healthcare and interventions that go all the way to the grassroots. These interventions have not been just the traditional interventions where early on we were known for flying and going to the communities and doing clinics and all that. But now what we are majoring on is to employ technology, especially in this era of the pandemic, where we may not be able to travel, where we may not be able to reach, but data needs to be gathered that will inform decision making. So we have developed solutions that are mobile friendly, especially for the communities, using feature phones that we are able to gather information across most of the African countries and consolidating them using the tools like ODK so that information is able to help us and make the right decision. We have also invested in training using still the technology. We have platforms like Jibu. Jibu platform helps people and especially community health workers, some of them who are volunteers and nurses, to be able to be trained on how to handle emerging cases. And it came in handy so much in Africa region when traveling and having meetings was not possible. But then we were able to train so many people, and especially nurses, on handling things like COVID cases. We have also gone to a point of being contracted by governments to be able to train nurses. Case in point, we have Ethiopia that asked us to do like training for all the nurses in the country using this platform. And this has also helped us to gather in data that has informed us on disparities in health. And we've had the same in Malawi, we have had the same in Kenya and Zambia. So some of these interventions have also come in handy to help us to partner with key people in the industry and reach the people. As you may also know that our greatest campaign is the universal health coverage. Yeah. And we have also tried to reach as many people as possible, advocating using technology interventions to the governments, advocating for budget allocations. So there are so many interventions that we have been doing, over and above having digital systems that are working for us across the globe. Thank you.
Yeah, and I know both of you, you've mentioned about the mobile platforms that you get to operate in, and that means you get to collect a lot of data in your daily operations, and that means that you now have the ability to provide individualized care to patients. How are you tackling that as an organization, Nikki?
Yeah, just to underscore what you've mentioned there. So for a platform like MyDawa that is built on the very core beliefs of being able to offer not just quality products and services, but also convenience to the customer, as well as privacy, then you find that because we're operating in the e-pharmacy space, we are able to collect a lot of data, which again, through intelligence, business intelligence and everything else, allows us to be able to personalize more the experience of our customers. But now, I think there is a process into getting there, because you've got to make sure that the data that you're collecting is able to be analyzed for the benefit of the business and for the benefit of the customer, to give them a better experience. But at the same time, there is the sensitivity of that data, because dealing with healthcare, most of this data is of a private, or rather, it's confidential to the patient or to the person that is providing it. So in this case, the subjects of the data that you're holding then are sensitive, because you wouldn't want this kind of data out there or in any way exposed to misuse of any kind, and you're holding it in trust of the subject. So given our nature of the digital platforms that we have, because we are available on apps, both on Android and iOS and on the web, and then we're doing deliveries, we're able to deliver both in Nairobi and upcountry in partnership with our courier partners. Then all this data now becomes quite a huge, it's huge data that you need to slice and dice and kind of consume in making decisions for the different segments of customers that you're seeing. So for us as MyDawa, we've employed quite complex tools in business intelligence to be able to make sense of really what are the customer trends that we're seeing, what are their specific needs, what are the specific needs of the specific customer segments, and what kind of experiences are they looking for. Now, like I mentioned before, I think we're dealing with a more informed customer than ever before. And the more informed they are, the more specific they are to their expectations. So when we talk about personalized healthcare service, then every one patient or customer you deal with actually is different from the other in terms of their expectations, in terms of what they want, how they want their experience to be packaged. So we're using this data to kind of tell how to approach different segments of our customers, how to further personalize that experience, And I'll give you an example. You have, given this COVID period where movement was highly restricted, so you have so many people relying on home deliveries, for their medicines or for their supplements of their personal care products. And there is somebody who will order because they just don't want to get out of the house, right? Because of the movement restrictions, they just don't want to bother and take that risk. But then at the same time, there is another customer who will order perhaps because they know you will deliver on time, right? Yeah. So you will have a customer who is purely just convenient. I don't want to leave. But there is a customer who is, no, I want this within the shortest time possible. Yep. Now, you have someone else who is already on some kind of a plan. Think of patients who are on, for example, chronic kind of care, or rather the chronic space, of diseases in our patients. They already have a plan, and they know when they need what. They know when maybe they need certain medication or they need a certain service. And these ones, they're better planned in terms of how they order for their products and services. So with all this, you've got to be able to understand what segment lies where, and the only way to do that is to employ advanced intelligence, business intelligence, analyze this data and be able to make decisions that not only serve the business better, but improve the customer experience, because the expectation with the customer today keeps on going higher and higher, like I mentioned, because we are in a space where we're doing everything from the mobile phone. We are consuming data more than we've ever done in the life of humanity, or rather in the period that we've existed as human beings. So you're not going to be able to convince a customer about the superiority of your service when they can compare that with another service that exists that they're able to access or compare with from a platform, an online platform, maybe their mobile phone. So for us is now making use of this data that we're collecting to analyze and see then what kind of experiences do we need to package for the different segments of our customers.
Okay, thanks for that very elaborate answer. With that, you've mentioned a lot about security, and this will go to Samuel. And now you have data that is sitting on the patient's phones and etc. But sadly, we have a lot of healthcare solution providers. We are not talking to each other. How do we, as people within the healthcare space, enhance data portability? That means I got prescriptions for my dawa. I walk into Ghetto Children's Hospital. I sit down, the doctor is able to see in the system, this is the kind of medicine he's been consuming over this period of time, and they're able to give me better care. When I go to another hospital like MPSHA, then they're able to also access that kind of data. So Samuel, how do we improve our space to be able to enhance data portability, but still ensure that we have data security? Samuel?
Wow, that's an interesting question. I think we're operating, as my colleague has said, in an era where information is being handled in a very sensitive manner. I'll talk from the AMREF perspective and our experience is that because of operating in different countries and continents, we have a big challenge with the data. We are all aware about the GDPR issue that especially in our European offices has been quite a major challenge. Now there are regulations that have trickled down to African countries, and I'm happy that Kenya is among the leading countries that is really keen on data protection. It's unfortunate that so far in Kenya we have not integrated as much. I think the critical thing is that is a major drawback or a hindrance is the whole thing about data protection and privacy. Medical data is not just like any other data. I think it's quite sensitive. It is hard to share. And the fact that you're supposed to seek the consent of the patient to share that information with another healthcare provider becomes another complex issue, because the trust issue and also the sensitivity of the information. However, I see this coming to pass where we shall have a central repository or a central data system, and the government of Kenya has tried, but much of the information about, say, for example, diagnosis and the treatment of the patient care is not shared. So I could share that somebody has requested my DAWA to give prescription for this, but more likely, because of the same privacy protection issues, we find that they'll just say, so-and-so visited my clinic, and for further details, visit our clinic. So the regulations also are not yet up to speed in terms of sharing that information. But I think the technology is there, databases are there, technology is there, and innovations around this sharing is there. We have seen it in other sectors where, for example, like how, for example, in Kenya, where Kenya Power is sharing the PIN numbers for the number of meters, and they're able to share it with KRA, and they're able to track about the tax collection. I see that coming very soon, but it will require a lot of legislation to have it effective. But for now, I think we are not yet there. That's the way I would look at it.
Sorry, I feel like there's a statement you might need to clarify. You've said that the data protection and the data privacy is a hindrance. I tend to think it's more of an enabler, because now we'll be required by the Act of 2019 to do data portability. That means a patient can move from one place to the other with their data. So how is it a hindrance, Samuel?
Okay, it's in two ways. At the point where we are in the industry, we have not matured enough to get there. Okay. But the whole idea or the whole concept is geared towards that portability or data sharing across. But I think I'm talking now even from, we have a clinic that we see patients. We are flying patients across the globe. But the biggest hitch that we have is in our flying doctors and all of the information that we do, including sharing what you call wing-to-wing transfer of patients. That information flowing, the insurances across, especially Europe, is still a major issue. But the whole intention, the spirit of this legislation is geared towards portability. But where we are is still like a bottleneck, I would say.
Okay. Yes, Nikki.
If I could come in just for a moment and just highlight something I thought I have around the whole portability. Some 2-3 years ago, I was involved in more of I wouldn't call it a study, but we're just trying to understand just what kind of legislative framework we have for some of these things like data exchange, and really from a policy point, what kind of guidelines can an industry player actually rely on while making their decisions on how to enhance data portability. And I must say it's interesting because I think as a market we still have some distance to go before we have full portability, in that we seem to operate in our own internal institutions kind of standards. So today, as a market, for example, I do not think we use the same, for example, diagnosis, clinical diagnosis coding system. So you find that service provider A and service provider B would have, it's data about the same patient, but how it is captured and stored then creates some kind of barrier in its exchange. For example, we know that the health insurance portability and accountability standards protocol, that's the HIPAA compliance, for example, has been used globally for a while, adopted by countries that have already crossed that bridge of data portability. But I don't think we've looked at it as an industry and agreed that we're going to implement it across our platforms, so that then our exchange of data becomes one, there is a level of trust when my system is talking to your system from a security standpoint, from how the data is processed to how it is stored, to avoid misuse and exposure. So I think we, as players, maybe it may not be up to the government at this point, but I think on innovation, we would need to come around the table and agree on how to make, on how to use common standards and more so globally accepted standards to enhance portability. Because I think today we're still playing at the institution level. So as my DAWA, I could code my services and products in a certain way that is different from another provider. So when it comes to trying and to port this data across, then it creates a challenge. And more so now with the Data Protection Act, then the challenge becomes, if you have a portability issue between platforms, then the data ends up coming out of the loop of security between the systems, and now you end up introducing manual steps that can actually now expose this data. Because if today I was moving my clinical data from provider A to provider B, I'll probably have to move the physical file, from how we're operating today as providers. And I'm talking about hospitals, I'm talking about clinics and other providers, stock of labs and all that. So I think as an industry, we are now at the point where, because we're all trying to leverage on innovation to offer better services to our common customer, then we've got to take up the challenge and discuss and agree on what standards are we going to use to ensure that our systems can actually talk to each other.
Yeah, and you've brought a good point about sitting on a round table. And yes, it is quite important for us to all get into partnerships. And to what level we'll need to agree on where we can sit. Do we go through the Healthcare Federation? Do we go through the Association of Private Care Providers and talk to government and that kind of thing? What kind of partnerships do you think that we should look at in the next 1 year, 2 years, 5 years, so that we resolve this? So we'll start with Nikki, 2 minutes, because now we are winding up. And then we jump into Samuel to finish for us with that same question about partnership. So Nikki?
Thank you. Thank you for that. I think really, to get us there, we've got to look at the healthcare industry from a technical perspective, not as a standalone kind of space, but that is interlinked and has integrations across other verticals. And by this I mean, you have tech providers who are building solutions for healthcare. You have lab, for example, providers who are bringing in technology, for new technology that is more efficient, more accurate in capturing whatever lab requests and identifying scenarios that we didn't have before. Then we have the traditional healthcare providers. Now we're talking about, when I say traditional, is the actual clinical practice, which is also growing very quickly towards online presence, digital presence through telehealth and telemedicine. So how I see it is, in terms of partnerships, we need to stop looking at each other as competitors in the sense of what is mine and what is yours, but look at it that we are serving the one common customer, who is our patients. That is our customer. It's a common customer. So it's more like trying to say, okay, look, guys, we have to agree to sit down, draw up some rules. This is a game of football. We have a referee. They need to operate from a standard set of rules. Then now it's the appeal of my innovation and my service delivery that will give me my customers against the other persons. Now, when I say this, what I mean is, for example, today, as a pharmaceutical, as an e-pharmacist that is in the pharmaceutical space, I shouldn't feel that I cannot access patient data from a provider like, let's say, MP Sharp.
Okay.
Or they shouldn't feel that they can't see what they prescribed if it's what we actually gave the patient.
Yeah.
We should be able to have that flow working, but then I think we need more industry players than just the actual healthcare providers, that is the hospitals, the clinics, and the pharmacies, and lab and all that, but also expand this again to the supporting providers, that is the IT developers, that is the solution developers in IT. We have ambulance services. We have people doing wonderful work that AMREF is doing, because they'll need to work with these providers here, right? So in terms of this roundtable, and I'm happy with what,
yeah, we have to jump into Samuel on the same. You've mentioned about the, you've just jumped in on the industry players. So Samuel, just wrap it up. What kind of partnerships we will require?
Very quickly, I think any industry that will not embrace technology will not survive. That includes the healthcare. We need multi-stakeholders in this whole issue, and we also need interconnectedness. In brief, I would like just to give an example of what
we might not be able to. Sorry, Samuel, we might not be able to take the example.
Okay.
Yeah, really, we have to wrap it up. What we'll say, thank you guys for participating in our session today. It's been quite an engaging from Nikki and Samuel. They've really explained how the industry is shaping up. Over the last 2 years, we've seen a lot of digital transformation across the different sectors, and healthcare has not been left out. We're going to require more partnership, more collaboration, and more adoption of technology in order to give our patients good care and achieve good clinical outcomes. Thank you. It's been a good session, and we hope you enjoy the rest of the year ahead session by CIO. Thank you.